Hi there, my name is Marla Neufeld, and welcome to the Surrogacy Space. Today I'm joined by Dr. Joshua Bitran, urologist at Mount Sinai. So it's a very distinguished guest today, and so thank you, Dr. Bitran, for joining us.
Absolutely. Thank you so much for having me.
Yes, and for our listeners that might recognize his name, we had his wife Vivi on the show recently talking about her at-home medication company. And so the fact that you both could join us is extra special. So thank you for your time.
Thank you for having both of us.
Yes, for sure. And we'd love for just to share with the listeners a little bit about yourself, your background, and what led you to specialize in urology.
Sure. I'm born and raised in Miami. I grew up in a family of medicine. My dad's a doctor, my grandfather was a doctor, and I always knew that I wanted to go into medicine, but I really didn't know what specialty I wanted to go into.
Okay.
And so when I was in medical school, I was able to get a rotation in urology, or actually I was placed in that rotation. I had no idea what it was, but I fell in love with the ability to treat my patients both clinically and surgically, which is not a very common thing that you can get. So it was also beautiful. Like even in that small rotation, I was able to see the patients follow through after their surgeries or follow up what medications they were on, and I got to see that those were patients that had been seeing that doctor for years. So it was something I really liked.
Yeah,
Uh,
that's amazing.
yeah, and so I'm a general urologist, but I am very passionate about men's health and infertility. So during my time in medical school, especially, I published a lot of papers in this area. And then on more of a personal note, my wife and I are both infertility patients. And for several years, we went through multiple rounds of IVF, and finally, we were able to have our two beautiful boys.
Awesome. It must have been so hard but interesting. You know so much about, male health and having gone through it yourself, it just adds a whole nother layer. It's like a lawyer going through a legal agreement for themselves. It's like you know too much information.
100%. And it's such a different experience. And I really think it gives you so much insight
Yes.
into your patients that you're treating when you see it from the other side.
Yeah, it adds a personal touch and sympathy and just an extra level of wanting to be there and help your patients, I presume.
Yes, well, 100%.
Yeah, well, that's awesome. I mean, it's interesting how school can really enlighten you into an area that you didn't necessarily know so much about and that you just took to it. That's just what it takes sometimes is that spark. And it's just as an aside, your dad has been a doctor to some of my surrogacy patients and such a
Uh-huh.
highly respected man and physician. And so whenever I hear your family's name, I just know that whoever's with you will be in good hands.
Thank you so much. Yes, my dad is really an amazing man.
That's awesome. Yeah, such a leader in the industry and such takes such good care of the clients that I've had. But moving on, I'd love to talk
Mhm.
about sperm today, which is
Absolutely.
not a common topic amongst my podcast or even just like the surrogacy world. I mean, there's so much, rightfully so, focus on the woman, the surrogate,
Hmm.
the intended mother, but there's still a whole other component is the sperm. So, just to start us off, what are some of the common misconceptions about male fertility that you encounter within your studies and practice?
Sure. So I think one of the most common misconceptions is that fertility is a female problem alone,
Hmm.
right? So whenever a couple is having issues, what happens? The woman goes to the OBGYN, and the
Yes.
man just kind of sits back
Hmm.
because there's just this assumption that everything's fine. And I think it's because men have this thought of, okay, I'm healthy, so my sperm is healthy, which is
Mm.
not exactly the case. But male infertility actually contributes anywhere from 20 to 50% of couples struggling with infertility, which
Wow.
is
Yeah.
something that is definitely not mainstream. And I really wish it was. But if I had to think of one, I think that's the biggest misconception.
So is that something like when someone's going through what's defined as infertility, whatever certain amount of time the doctors feel they should be getting pregnant by at that point? Like, is it recommended that both male and female get tested?
That is something that we are pushing for 100%.
Yeah,
Yes.
just to rule it out. I mean, and in my mind, it feels like ruling out the male is like there's a little bit, it's a little more black and white to determine the issue. For me, like I saw with ourselves, like the woman issues were so like deep and hard to understand, but ruling out the man's important. You can kind of do it and figure
For
out a
the
lot of
most
the,
part,
yeah,
yes.
yeah,
Because really our kind of upfront test will tell us whether or not there's a problem. And even if
mm,
further testing is needed,
right,
it's kind of pretty clear as to where we're going to go.
yeah.
Um, so
So what,
it's definitely more complicated with the woman's
yeah,
sometimes.
right, right, right. Of course, fixing an issue is a whole nother story, but
Yes.
seeing that something's going on. And what are some of the steps like that a urologist does to assess male infertility or issues with the sperm?
Sure. So typically when a man comes in for the first time for a fertility evaluation, we start with a detailed history and a physical exam. For the history, we want to know, is there anything in the past, any trauma to the genitals, any exposure to chemicals, and that could be anything from chemotherapy to radiation as a child, which is a huge one.
Hmm.
Um, and then with the physical exam, one of the most common things that we see are varicoceles, which are dilated veins around the testicle that can change the environment of the sperm production. Those are, right off the bat, the very common ones. But then always we do a semen analysis, which is the gold standard to
Okay.
check, as well as a hormone panel. So with the
Interesting.
hormone panel, it'll tell us whether or not the body's producing the appropriate hormones. And if the levels are off, it really clues us in as to where the issue might be and what the next step might be.
Hmm.
Uh, and then with the semen analysis, it tells us a whole bunch of information. We have the semen volume, the concentration, motility. You can do viability testing, all these different things that kind of clue us in as to whether or not there's enough sperm being produced, if the sperm that's being produced is healthy.
Hmm.
And typically, if it's 100% normal, we kind of send them back and, clean bill of health.
Okay. And what role does the quality of the sperm play in a successful pregnancy, be it natural or through IVF?
So it kind of depends on what all of those different numbers show. If the concentration is very low, depending on those levels, it'll tell us whether or not we can even do something like IUI or even traditional IVF. Sometimes you have to do ICSI because there's not enough sperm,
Right.
or even if there's enough sperm, it's not motile, it's not moving, so it won't get to where you need. So, yeah, huge factor on whether or not IVF will be successful.
So do your recommendations, do you work in partnership with the fertility doctor or it's like, or they that then have to go see a fertility doctor? Like how much can a
So
urologist do with this?
So typically, in the situation where you're gonna harvest the sperm from the male, what you do is you have to be in very close coordination with the REI,
Yeah,
because typically you want to get the freshest sample of sperm to then fertilize the egg. So
right.
typically it'll be the same morning where the male patient will come to us, give a sample, or we'll extract the sample depending on the on the patient's situation, and then
Okay.
that'll have to be brought over to the REI's office where they're doing a retrieval procedure on the partner, which means
Okay.
the whole IVF cycle has to be coordinated. All the injections, all that needs to be coordinated. So very closely.
Yeah, really. Talk about just like down to the minute and time. And I remember from my
Yes,
husband being like, get straight to the doctor. Don't take any pit
exactly.
stops. So I remember those days. But that's so interesting and so interesting for you to have all these different players, to help make this successful. I think it's really wonderful.
Yeah, it's, one of the few areas where you have kind of this coordination across specialties, like really down to the minute. It's really
Mm,
nice.
it's very true. And so, for our listeners who just want some tips about, male health and ways that a man can make healthy choices to improve sperm quality, I mean, is there any correlation between lifestyle and sperm?
Definitely, things like reducing stress, anything that's really good for your health is going to be good for your sperm. So
Okay.
barring any really serious abnormalities, like no, if there's no sperm in the ejaculate, no amount of
Right.
juicing
Vegetables, right.
is going to help that. That you definitely need to see a urologist for. But in somebody who may just have borderline values or something like that, sometimes we'll even just repeat the semen analysis after someone will put them on, and they'll do some exercise, lose some weight if that's an issue that they have. Try and move away from processed foods, all those different things. If you smoke
Wow.
tobacco, if you smoke marijuana, which we can get into, all those things can really affect, your sperm quality. And then
Hmm.
we could do another semen analysis, and a lot of times the numbers do improve.
Wow. Just from like a
Yes,
fairly simple lifestyle change, you actually see changes in the sperm.
100%. Yes,
That's fascinating and should be inspiring to anyone listening, that might just need some adjustments to help improve, their health with that. So many impacts.
absolutely.
And I mean,
Yes.
it sounds like there's a lot to the marijuana, just given that it's such a common thing. Like what are the impacts of that on sperm?
So it's very interesting. The studies that have been done really suggest that especially heavy marijuana usage will affect every single metric that we have. So that's
Hmm.
concentration, motility, morphology, viability. So whether or not the sperm that you find is alive, and capacitation, even, which is the ability of the sperm to actually enter into the female egg.
Mm.
So each one of those are individually impacted by especially heavy marijuana use.
Is there a
So
distinguish between smoking or the edibles and all of that, or is it just the marijuana itself?
you know what? That's a very good question, and I don't have that answer off the top of my head.
Yeah, I'm sure it's some
But most of the
evolving.
studies have been done with smoking marijuana.
Hmm. And is that it's reversible? I mean, from what you're seeing, there it can be improved by stopping.
100%. So the kind of the life cycle of the sperm is just under 3 months. So typically, if we're going to
Interesting.
make those recommendations, we say to stop or reduce as much as possible for 3 months, and then repeat a semen analysis and see what the outcomes are.
So interesting. I mean, wow.
Yeah.
And so just leading into what are some of the most common issues you see with sperm that could impact fertility?
Sure. So especially on the pure male infertility side of things, there are a couple. I had mentioned the varicocele, which is extremely common in the general population, even in those that don't experience infertility.
Hmm.
Something like 15% of men in the general population have a varicocele, and that does not mean that 15% of men are infertile. But we do see that about 15 to 20% of men with a varicocele will have some kind of fertility issue. So it kind of increases the temperature of the testicle, and temperature is very important for sperm production.
Mm.
And so when those patients come in, if they have abnormal sperm parameters, that is something that can be repaired surgically
I
in that
see.
situation.
Okay.
You also have something called obstructive azoospermia, which is a fancy way of saying a blockage in the system. And
Okay.
sometimes with surgery, we can bypass that. Or, we can just take the sperm out from before the blockage and use that for IVF.
How invasive is
Um,
that procedure, removing sperm like surgically?
so it can be done in a variety of ways. Sometimes you can just do it with a kind of a big needle, which is the least invasive way of doing it. Or there's another way where, this is done under sedation or anesthesia, where you make a small incision and you kind of open up the testicle and kind of remove out some sperm. In the grand
Interesting.
scheme of things, these are very small procedures that people
Okay.
heal very quickly from,
Okay. Good to know.
even though nobody wants to hear about us cutting into them down there.
Right, of
But
course.
that's a
Especially
different,
for something that many times can be done, like it's the not so hard part of the IVF process for the men, but yeah.
exactly. Yes.
Yeah.
Um, and then there's the other causes. So we have non-obstructive azoospermia, which again, just a way of saying it's the testicle is not producing sperm for whatever reason. There are even ejaculatory disorders. So you
Hmm.
can produce healthy sperm, healthy semen, all the tubes are in order, all of that, but you can't get the ejaculate out. So that can be an entirely other issue. People can have infections, so usually STDs in the past or
Mm.
prostatitis. It can cause scarring or partial blockages. And a really common one is somebody who's had an undescended testicle. So this is a very common thing that we see in young boys.
Okay.
And so it's something that if it's repaired very early on, there can be minimal effect on fertility. But if it's something that is overlooked,
Hmm.
it can cause severe damage to the sperm production in the future.
Wow. That's interesting.
Yes.
Okay. And then what would be an indicator of when you feel like a man should come in to get tested? I know you said it should be part of a routine of an infertility, but like what point do you think that's reached by a patient?
So it can be nuanced on the situation, but the typical guidelines are saying if you have a couple that's both under 35, usually they say try a year per
Hmm.
year, which
Yeah.
can be a long and stressful time.
Yes.
A lot of times they'll say, if you're really concerned, come in at 6 months. Definitely if you're over 35, and that's just because the woman's age becomes
Right.
an
High
issue if
risk.
you're going to be, yes, that the even with IVF, the percentages of successful pregnancies start to go down, especially if you're going to be implementing um, different techniques that may take multiple months before
Right.
seeing an improvement. Um, but if somebody has an issue like chemotherapy in the past, radiation in the past, kind of just say right off the bat, come in.
Mm, yeah, just go right to it. That makes a lot of sense.
Yeah.
And just for like a non-fertility patient, is it recommended that men see urologists on a routinely basis at a certain age, like how women should be getting mammograms? Is there a best practice on that?
So there is not a best practice on that. You're definitely striking a nerve with me, something that I'm very passionate about. That it's really, there's very few things that will bring a man in to see a doctor. Obviously, I'm
Yeah.
speaking generally.
Yes.
But typically men will not start seeing a doctor until their
Their
partner
wife
tells them
makes
that they
them.
need to.
Yeah.
100%. That's like your
Yeah.
typical scenario.
Right.
And typically things that bring them in are fertility issues or sexual issues. And that those are things that just bring them in.
Right.
But I think there should be a change in this mentality, and I wish that was implemented earlier, whether it's men going to the PCP much earlier or seeing a urologist, whatever it is. But I do think that, because women have reasons to go to the OBGYN much earlier, they end up catching things earlier or just being in general way more aware of their health, as opposed to men that a lot of times we're behind the eight ball because we're stubborn.
And are you involved with like prostate health and those types of examinations as well?
Absolutely. 100%.
Yeah, so I mean that's just so important. I mean, a whole nother topic, discussion, but just being
Yes.
screened and checked, I think, is imperative to detect anything early on.
Yes. And once we're doing that, I mean the ages that we're doing that are starting to go down, but typically, people or men in their 50s and 60s, when they're finally convinced that they have to go to the doctor to get their prostate checked, the PSA levels, you ask them
Hmm.
when the last time they were at the doctor, and they're like,
They don't even
my
have a
first time,
baseline. Yeah. What is the best
and
practice
it's
for starting to check? I know this is not fertility related, but what is a good age
Mhm.
to generally start checking PSA levels?
So the recommendations recently changed to go younger. So it used to be 55, and now it's
Okay.
actually 45. And people who have
Mm.
no history of prostate cancer whatsoever, and
Yeah.
even
Yeah.
younger if there is a history of prostate
Family.
cancer.
Yeah.
Yes.
I'm a big proponent of that, going early and getting checked. I mean, especially with family history, because it's something that could help success rates if something, is detected.
What 100%. And kind of one of the side things that really got me hooked into urology really was if you're going to a urologist for something like cancer, typically it's something that is at least in theory treatable because it's something extremely localized. We've caught it early and we can
Right.
do surgery to hopefully cure, which is amazing to think about that.
I, yeah, and the earlier the better. That just makes such a big difference. So
Hmm.
I'm right there with you. Get it checked, get it checked early. And just to end, I mean, what are some of the advancements that you're seeing from a medical perspective for treatments of male infertility? I'm sure it's evolving just like everything else in the fertility world.
100%. I think one that really got my attention, and I think it got some national attention very recently, maybe about a month ago. I forget exactly which group. It's out of New York, but they're using AI to look for sperm in samples of patients that have previously been told that there's zero sperm in the ejaculate. And so that
Huh.
means trained embryologists are combing over this for hours and they find nothing. And so it now they've fed this program, this AI to look for what's called hidden sperm, which could be, sperm behind a cell that no one could ever see. And they've
Wow.
actually achieved a successful pregnancy in one of these patients. So
Huh.
I think that's something that's extremely promising, especially that group of patients that have zero sperm who are kind of given very little hope from the beginning. It's at least something that shows some promise.
Wow. So zero is not always zero anymore.
Exactly. Yes.
That's fascinating. I mean, I've never heard of hidden sperm, but that's the fact that we can use
Yeah.
technological advancements to help. That's amazing.
It really is. And I love that. That's one of the things I also love about urology is we tend to be very accepting and very early adopting of new technologies
Yeah.
in our practices.
Yeah. I mean, whatever can help the patient make it better for them, I think it's the way to be. And you can tell that you're just so passionate about this area of medicine. And I know you're going to go so far and be so successful with your practice. So I wish you so much luck. And I hope that whoever can go see you will at Mount Sinai.
Thank you.
And so I just really appreciate your time and sharing your wealth of knowledge. And just thank you for your passion and what you do.
Thank you so much. And I really appreciate you having me on today.
Thank you, Dr. Bitran, and we'll be happy to share with our listeners how they can reach you and find your practice at Mount Sinai for future questions and follow up.
Perfect. Thank you.
Take care. Thank you.